Hello, my name is Lori Marion. I am the nurse in the office as well as the IVF coordinator. I like to refer to myself as your tour guide or cruise director through the IVF process. I will be meeting with each of you individually to go over in depth how to use your medications, why you're using your medications, but please refer to these videos for any refreshers you may need along the way. And as always, please feel free to contact myself or Dr. Yasinkaya with any questions throughout the entire process. Now we're going to discuss how to mix your Menopur and Gonal-F that you'll be using during your IVF cycle. We mix the two of these medications together to limit the number of injections that you're going to have to take in total. Step one for mixing these medications will be to mix your Menopur. Menopur is a single dose vial that you will mix a brand new one of every single injection. So to do this, with inside this box, you'll have medications that look like this. You'll need one powder and one water vial that are packaged side by side together. And you will need one of your pink package needle and syringes for the mixing. To mix, you will draw out 1 cc or 1 milliliter of the water. There are 2 in the vial, so you're going to have an extra cc worth to throw away. To do this, hold the syringe and vial at eye level. Draw back to the 1. So make sure that the top of the black part of the syringe is equal to the number 1 on the vial or on the syringe. You'll notice that there's a lot of pressure in these vials, so anytime you're handling the needles and syringes, support the plunger where you want it to be. Otherwise, you'll notice that this will happen and you will lose all the liquid you're attempting to draw out of the vials. So, support the plunger. When you get to the level you need to be, take off the vial, discard that vial, get it completely out of your workspace because you don't want to confuse it with other vials that we're going to be using in a moment. Inject that into your Menopur powder vial. The Menopur starts out as a little cake of powder. As soon as you put the liquid on, you'll notice that the powder disappears and becomes liquid. To make sure this fully happens, swirl the vial, no shaking, only swirl, to make sure that everything is thoroughly dissolved. Then you're going to want to lay this needle and syringe that you're using to the side for future use. Now we're going to mix the Gonal-F. If you will notice, it says multi-dose, which means that you'll mix this medication one time and use the one vial multiple times. Unlike the Menopur, as I mentioned before, is single dose, so every shot you mix a new one. Yours will say anywhere between 450 IU to 1050 IU multi-dose vial. What that means is once it's reconstituted, that's how many units total Gonal-F will be in that vial that you can use over multiple shots. When opening the box, you'll notice there is a pre-filled syringe of water, a vial of powder, and a bunch of needles and syringes to the side. To prepare the Gonal-F to use, you are going to inject this entire pre-filled syringe of water into the Gonal-F powder vial. Once this has been put in, swirl to dissolve to make sure all of the powder has dissolved within the vial. You can throw away this syringe in your needle sharps container because you will not need it at any other time. Now we have a vial that contains, again, anywhere between 450 and 1050 units of Gonal-F. To get the dose of Gonal-F that you will need, you will use the syringes located in the box of Gonal-F. These syringes are labeled in units. The amount of Gonal-F you need will be determined by your doctor. It can range anywhere between 75 units all the way up to 300 units per shot. And again, this will be determined by your doctor and will have been gone over with you either by your doctor or by your IVF coordinator in advance of starting your medications. For our purposes today, we're going to draw out 150 units. And if you'll notice, again, there is on the vial the number of units ranging anywhere from 75 all the way down. You'll draw out the number that the doctor told you to use. Then this Gonal-F, as you see, there's a lot remaining in the vial, should be placed in the refrigerator until your next injection is ready to be done. At this point, you'll take the Gonal-F that you have pulled out and inject that into the Menopur solution you have already mixed. This syringe at this point can now go in your sharps container also, because there's lots more in the box where it came from. We now have a vial that contains all of your injection. You took the Menopur powder, added your saline to it or your water to it, and now have added the Gonal-F mixture to this same vial. That is your injection. You will now take the pink needle and syringe that you laid to the side that you initially mixed Menopur with and draw out this entire mixture. Again, the easiest way to draw medication out of vials is hold it upside down at eye level, pull the tip of the needle very low in the vial where you can see that it always remains submerged fully in the liquid, and slowly draw back, making sure that you get everything out of the vial. Once you feel like you've removed everything, support the plunger so the liquid does not go back into the vial. Remove the needle from the vial. Always double check the vial to make sure all the medication was withdrawn. This vial can now go in the garbage, and this will be our shot. Recap this pink needle. We do not want to give ourselves a shot with it. It's very large and would hurt. It screws off, as you just saw, and you'll receive a bunch of brown packaged 30 gauge needles. You will screw this on for your injection. At this point, if there's any large air bubbles in the syringe, you can get rid of them by simply flipping the syringe. It will float the air bubbles to the top, and you can just push the plunger up just a tiny bit to get rid of any of the air that may be in this syringe. Now, the shot is ready to be received. You will give this shot, if you'll refer to my diagrams here. We normally prefer for the IVF injections to go in the lower belly. I would say draw an imaginary line across your belly button, anywhere in the lower part of your stomach that you can pinch up some of the poochy skin, is how I put it. And you'll see in figure 4, them doing that exactly with your non-dominant hand. Pinch up some skin. Take an alcohol swab, which you'll have received many of in your package, clean the skin thoroughly, and inject into the fatty tissue that's being pinched up the needle. This needle should go fully into the skin. It's a small needle, so it should go the full depth of the needle. Inject the medication, pull out, and then the needle can be disposed of in your sharps container that you received with your package.